Germany just banned college tuition. Now, prior to 2006, I lived in Germany 86, 87, and there was no college tuition then. College was free. In 2006, and I believe that was the election that brought Merkel in. I could be wrong. But, you know, Merkel is a conservative. She's sort of a Bob Dole conservative, but she's a conservative, the Christian Democratic Party. And in 2006, Germany actually allowed tuition. They allowed colleges to start charging. I mean, it was only the maximum tuition in the country is about $4,500 a year, but they allowed it. And now, I think it was Lower Saxony, now the last of the German states to allow colleges to charge tuition, has banned the practice. So in Germany, because they have a national healthcare system, you cannot go broke because you get sick. It doesn't happen in the country. And you cannot go broke or graduate from college broke because you went to college. This has to do with the commons. Let me take this a step beyond just college, because there's all these areas that have to do with the commons where conservatives have been hell-bent for leather to bore holes into our commons to create opportunities for profit. When the things that have to do with our commons are better done by government. This is why government is created. Ronald Reagan wouldn't want you to know this. You're not going to hear this on right-wing talk radio. Now, you will understand this if you take any government class or any history class. But the purpose of government is to administer the commons for the public benefit, for the public good, for the general welfare, as our Constitution says in 2 or 3 different places. So here now we have this article in the New York Times, doctors find barriers to sharing digital medical records. You and I, with our tax dollars, have given $24 billion. $24 billion to hospitals, doctors' offices, and by pass-through, virtually all of it went to companies, for-profit corporations, the largest of which is discussed at some length in this article in the New York Times, Doctors Find Barriers to Sharing Digital Medical Records by Julie Cresswell. It's called Epic. It was founded by Judith Faulkner, who is now worth over $2 billion. So you can make serious money when you are doing the business of the commons for profit. But here's the problem: as for example, as Julie Cresswell writes in today's New York Times, almost 18 months after the Epic system was installed at Unity Point Health St. Luke's Hospital in Sioux City, Iowa, physicians there still cannot transmit a patient care document to doctors 2 miles south at Mercy Medical Center, which uses a system made by another major player in the field, the Cerner Corporation. They also note separately, through its maintenance contracts and other agreements, Epic charges a fee to send data to non-Epic systems. And the woman who started this company is worth $2.3 billion, according to the New York Times, which raises the question. And she makes the point, the Ms. Faulkner, the woman who started the company, she makes the point the government didn't establish any standards for electronic medical records. They mandated them, but they didn't establish any standards. So we did. And our standards at Epic, in the case of this company, are thus and so, right? These are our standards. And it's secure, and it works well. And if you're within the Epic system, you can talk to each other. But if you're outside the Epic system, we're going to charge you extra to transmit your data, to modify, convert it, make it compatible, or you just can't do it. Now, this, she is absolutely right in saying the government didn't establish standards. And this is this post-Reagan belief that somehow standards or regulation are evil or bad, and that somehow the marketplace is going to solve the problem. Well, eventually the marketplace will solve this problem. There'll be one company left standing. And now that the Defense Department is about to put out an $11 billion contract for digitizing medical records to a private firm, and in all probability it'll go to Epic, which is, again, I'm not trashing this company. My point is that if we had said, if our federal government had said, here's the standards. You have to have this level of security. You have to have this level of intercommunication ability, whatever the word is, communication with other systems. Or if we had just done it ourselves, if the federal government had simply established this and said, here's a system. It's like Social Security. Social Security has never failed to pay a check. The IRS is actually quite efficient at collecting taxes. The Department of Defense, you can complain all day long, and I will not stop you about 700 military bases and spending more than every other country in the world on defense. But the fact of the matter is that the Department of Defense knows how to get things done. Government can work. Government does work. Our public schools are now demonstrably better than our private schools, our charter schools. So there is a time and place in the commons for government. Why do we have a brand new billionaire? Why do we have a woman who's worth $2 billion because she's doing something that we should be doing? We, the people, should be doing. Our government should be doing. Or at least the government should be establishing standards so that, in the lack of standards, what you end up with is whatever company owns the biggest platform ends up owning the marketplace because they're building walls around their system, which all of these companies are trying to do. They're all trying to say, we have this proprietary system. You have to use our system if you want to have, electronic medical records. And sometimes they scan documents, sometimes they digitize documents, sometimes they manually enter the information, and it's a mess. It's an absolute mess. Right now, something like 14% of doctors' offices can actually communicate this stuff. I mean, this is bizarre. And what it does is it creates essentially monopolies. We see the same thing with our voting machines. If we're going to use technology for voting, and we started out back in the 50s or 60s with these mechanical voting machines, and you could literally walk around the back of the machine and see the gears turning and see the counters incrementing. I did as a little kid. My mom was checked people off the list and said, here, go vote. So if we're going to have machines, let's have transparent machines and let's have government-owned machines. But no, we've got to privatize this. And then with the Help America Vote Act, George W. Bush, 2002, we've got to give billions of dollars to these for-profit corporations, Diebold, ES&S, et cetera, via the states, federal money just channeled through so that the beating heart of democracy is in the hands of private for-profit corporations. Our health systems are in the hands of private for-profit corporations. Our prisons increasingly are in the hands of private for-profit corporations. This is the libertarian paradise that the Koch brothers and the right-wingers and the Republican Party have promised us, and it doesn't work.